Hey viewers, today I'm going to tell you about coronavirus symptoms. There are 6 different types of COVID infections that can affect you. COVID-19 cases have breached the 18 million mark globally, and there's still a lot that remains unknown about the spread of the viral infection. Since it is a novel coronavirus, scientists are still trying to figure out as to why the infection impacts people differently, while many tend to suffer from a milder form of infection. Some belonging to higher risk categories carry a more severe risk, whereas others tend to be asymptomatic. Nonetheless, the same strain of the virus can leave lasting impacts on people even after they have recovered. While we still continue to battle the surge and might as well adapt and learn to live with the virus. A recent study done by King's College London has now found out that even though there is just a single virus which is making havoc over the whole world, there are 6 different types of infections observed in people. First week of symptoms are crucial. With no vaccine, one treatment plan approved for use, the only measures available are to practice preventive measures and stop transmission. According to the latest studies, the symptoms observed in the first week could be the key to detecting potential spread of infection. Symptoms in the first week could determine the spread and severity of the infection. Sampling different kind of symptoms observed in week 1 of infection in people, scientists say that the onset of symptoms could determine the actual likelihood of COVID-19 turning dangerous and a patient undergoing hospitalization. A study was conducted among 1,600 patients across the UK and the US who recorded COVID-19 symptoms between the month of March and April. Since most of the patients tend to visit a hospital only much later, the patients were asked to reveal details of the symptoms they suffered in the first 8 to 10 days of the infection. According to the sampling, 3 clusters were found to belong the mild category, while 3 belong to more severe category and more likely to impact those older or with pre-existing medical conditions. In order of severity, 6 main clusters of infections which could be identified were: the system highlighted in bold were the most defining and peculiar of a particular cluster. Cluster 1, flu-like infection with no fever. Termed to be the mildest form of infection, the first cluster suffered from symptoms due to trouble in the upper respiratory tract brought on by an increased viral load. People who suffered from this form of infection recorded symptoms such as cold, sore throat, blocked nose, chest pain, muscle pain, loss of smell and headache. Fever was absent in the infection phase. Now, cluster 2, flu-like infection with presence of fever. A little more cumbersome than the first cluster. Patients belong to this category attested to have symptoms of a mild flu. like infection, as well as the presence of a persistent fever and loss of appetite, hoarseness in the voice, which is characteristic of a dry cough or COVID cough, was also observed in this cluster. Now, cluster 3, gastrointestinal infection. Patients belonging to this cluster suffered from symptoms which impacted their digestion and gastrointestinal functioning. Even though cough was not prominent, symptoms in this cluster, nausea, loss of appetite, vomiting, diarrhea, were much more commonly observed. Headache and chest pain were also observed. Now, cluster 4, severe level 1 with fatigue. The symptoms observed in this cluster of infection related to energy loss, exhaustion brought on by immunity slowdown. Considered to be a warning sign for severe COVID-19 patients in this category, recorded going through symptoms like fatigue, headache, loss of smell and taste, sore throat, fever and chest pain. Now we come to cluster 5, severe level 2 with confusion. More severe than level 1, the type of symptoms in this cluster impacted nervous functioning and is considered to be the start of the lasting impact COVID could possibly have on the brain. Headache, loss of smell, loss of appetite, cough, fever, hoarseness, confusion, sore throat, chest pain, fatigue confusion, muscle pain were commonly observed in this category. Cluster 6, the last one, severe level 3 with abdominal and respiratory distress. This is the most alarming and severe kind of symptoms which set in people in the first weeks, experiencing symptoms like confusion, sore throat, chronic fever, loss of appetite, headache, diarrhea, shortness of breath, muscle and abdominal pain. People belonging to this cluster were much more likely to undergo hospitalization, require ventilation and oxygen support. What do we know so far? The symptoms described in the 6 clusters can give us a lot of inferences as to how COVID-19 impacts different brackets of people and provides a lookout of all patients. Headaches were persistent in all groups, which faded away after 3 to 4 days, barring the last 2 similar groups. Something of smell which kicked in patients only after the 4th day post-infection. Analysis suggests that the difference in the severity of infection could only be observed after 4 to 5 days of infection. Who requires hospitalization? Well, while patients belonging to the mild or moderate cluster were unlikely to record a symptom such as fatigue in the first week, for patients in severe or high risk category, some of the critical symptoms were observed on the start of day 1 itself. Some of the symptoms included breathlessness, fatigue, and abdominal pain. The researchers said the analysis pointed that people belonging to clusters 4, 5, and 6 tended to be older and frailer and were more likely to be overweight and have pre-existing conditions such as diabetes or lung disease than those with the type of 1, 2, and 3. It was discovered that only 1.5% of people with cluster 1, 4.4% of people with cluster 2, and 3.3% of people with cluster 3 required breathing support, considered to be a mark of degradation of the disease. Identifying clusters could possibly prevent the second wave and save lives of millions of people around the world. The study done by King's College is yet to be peer-reviewed or published. However, identifying the clusters can make people realize how crucial monitoring symptoms are and provide priority care to those who might need it more than others, and administer right tools to prevent a second wave in some countries. The parameters and specific symptoms could also prove to be a breakthrough and help doctors determine who is at most risk, take timely treatment decisions, and save lives. Our study illustrates the importance of monitoring symptoms over time to make our predictions about individual risk and outcomes more sophisticated and accurate. This approach is helping us to understand the unfolding story of this disease in each patient so that they can get the best care. Thank you guys for listening to my video. It is very informative. Please listen to it again and again. And please subscribe to my YouTube channel for more videos on COVID-19. Thank you.